I'm Dr. Paul M. Spezia of Advanced Bone and Joint. I have been taking care of maladies of the knee for over 27 years. And during that time of my practice, I have learned and have come to appreciate a continuum of care of treatment. Not all knees get the same operation. In light of that, there's multiple customizable operations for every patient out there. And having been involved with doing these operations, I think we can offer you the best treatment for your problem. So today I'd like to talk a little bit about non-arthroplasty treatments of arthritis. So here's a normal knee. This is the kneecap, this is the femur, this is the tibia. The patella or the kneecap can have arthritis on it, and it can hurt when you go up and down stairs. The femur can have isolated arthritis either in the lateral side or the medial side, again being very painful with very specific exercises, but the rest of the knee does not have any problems. So first I'd like to talk about doing micropicking. This is a procedure that's done arthroscopically on lesions less than a centimeter. For illustration, I'll show you this femur. This is a little larger than normal, but in an area of not non-weight bearing, so such as in a trochlear groove, this is a classic area where we will drill several small holes to allow bone marrow elements to come out into the knee and form fibrocartilage, which will give us, I tell patients it's like Kmart cartilage. It's not as good as what God gave us, but at least gives us some cushion and has good long-term results in non-weight bearing areas. That's easy to do. It's done arthroscopically. That's called micropicking. So we graduate up to a larger lesion, a lesion that's on the weight-bearing surface, predominantly on the medial side, but can be on the lateral side. This lesion is less than 2 centimeters normally in diameter. We can do a procedure called OATS, or Osteocartilage transplant, where we take either mini open procedure or arthroscopic small plugs of bone and cartilage from the non-weight bearing portion of the knee along the lateral side of the femoral condyle, sometimes medial, but mostly lateral, where we drill a hole and we put these plugs in, just like a zoysia plug, and we fill in that area with now not only bone but the cartilage on top of it, your own bone and cartilage, and we pack those in and allow those to coalesce, and that will give us a nice cartilage lining with bone backing. That's called an OATS procedure. Now, if your lesion on your femur is larger than 2.5 centimeters, that's too large to do an OATS procedure. We then do what's called a allograft transplant, where we take a femur from a deceased person that's been treated, we measure it, and we cut that piece of bone and cartilage and mill it on site to fit perfectly into this area. It's then press fit into position after it's been milled out with very specific and precise jigs. We put that in place. The body will eventually reincorporate into that bone, restoring normal articular congruity, and can help increase the longevity of the knee, preventing, hopefully, total joint or partial joint arthroplasty. Finally, there is osteotomies. Osteotomies are an indirect way of treating arthritis. So take, for instance, this knee here, the normal knee, and the knee has what we call a varus bow, or is bow-legged. You can see just from this picture how there's increased pressure on one compartment or the other, lateral or medial. You can actually do an osteotomy or cut some of the tibia and open it up to unload that side. So you're essentially unloading that portion of the arthritic compartment to allow it to have less stresses so you can wear it out for a longer period of time. Basically get more mileage out of it. Essentially rotating the tires on your car. That eventually, though, will result in arthritis on the contralateral compartment and then a total knee. However, this type of procedure allows you to be very active without any type of restrictions with weight-bearing activities such as running and playing sports. One additional non-arthroplasty treatment of osteoarthritis is cartilage restoration procedures. This has undergone a dramatic change over the last few years. Everything from where we would take a little chiclet of cartilage, grow your own cartilage, and then retransplant it, to now using embryonic cartilage from another source where we inject it underneath the membrane. This is not experimental, but is extremely difficult to perform and has limited use in everyday orthopedics. I do not do these procedures on a regular basis, but if it is one that is appropriate for you as a patient, I would refer you to the center that does that on a regular basis.